Hello, good evening. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. How are you? Thank you and welcome to our evening clinic. Today we're going to talk about the impact of caffeine on fertility. If you're a regular consumer of caffeine, how can it affect your fertility? Does it have any effect, positive, negative effect on your ability to start your family? So that will be the focus for our evening clinic. So please, when you join, I need you to tell me where you're located and your name, and we're going to get the clinic started. The first part of the clinic is actually going to be my discussion. Then the second part will be your questions, which I'm going to provide you feedbacks. If today is the first day attending my clinics are normally on Tuesdays, 6:30 p.m. Eastern Time, US, 11:30 p.m. Nigerian time. Then on Saturdays, 3:30 p.m. Eastern Time, 8:30 p.m. Nigerian time. So if you can make Tuesdays and Saturdays, you will definitely find me discussing about a topic I love talking about. So please quickly announce your presence so we can get started. Admin will be in attendance. So if you ever need any help regarding how we run our clinics, and there are so many helps you can get, and one of the major areas you can actually leverage on is our masterclass. We normally host our masterclass on Sunday, the last Sunday every month. So the masterclass for the month of July will be on gynecological disorders. There are so many gynecological disorders that might likely affect your ability to become pregnant. So if you're currently experiencing infertility, I strongly encourage you to go and register for that masterclass. We only have 100 slots. You're not going to regret it. We have a guest professor of OBGYN coming in from my medical school. He's going to help us to understand more about gynecological problems. But this evening, we're talking about caffeine. I know so many of us love coffee, energy drink, and some soft drinks. Guess what? Coffee, energy drink, and some soft drinks actually contain caffeine. And somehow, from current research, for some reasons, which we are still trying to understand, women that consume more of coffee, caffeine containing fluid, energy drinks, for some reasons, they take longer to conceive for some strange reasons. We don't really know exactly what's going on. But the impact of long-term more consumption of caffeine, it's actually a negative effect on ability to conceive for some inexplicable reasons. Researchers are still going through a couple of studies to see if they can actually find the link. But as of today, when you consume large amount of caffeine, so that means you take a lot of coffee, you gulp a lot of energy drink, or you take a lot of soda or some beverages. There are also some chocolate that contain caffeine. So if you consume them on a long-term basis, you might actually find it difficult becoming pregnant compared to someone that doesn't consume them. Now, the problem with all these caffeine-containing drinks, they are so addicted. So if you're not careful, once you start coffee, it will be difficult for you to stop. There are also some tea that contain caffeine. Now, besides the fact it might have negative effects on your ability to maximize your fertility, for some strange reasons, women that consume caffeinated drinks also have a higher possibility of having miscarriage or having babies that will be low weight. So these are the major concerns regarding consuming coffee. Delay in ability to become pregnant just the way God made you, and possibility of increasing your risk factor of having miscarriage or having a baby with low birth weight. Miscarriage is the unintended poor outcome of your pregnancy before 20 weeks. If it happens after 20 weeks, that condition is called stillbirth. So there are some women from current research we've noticed that if they consume a lot of caffeinated drinks, They might actually have difficulties becoming pregnant. And when they eventually become pregnant, they might also have a higher risk factor of having miscarriage or having babies with low birth weight. When you have a baby with low birth weight, your baby will be predisposed to developing some medical problems, which ordinarily, if the baby has a normal birth weight, the baby will not be exposed to that. So everything kind of, circles back. So caffeine are stimulants found in, the couple of drinks I've mentioned. It's found in coffee, black, green tea, energy drinks, soft drinks, and some chocolate. So the proof, it's not too clear. But like what we normally do, when we don't understand anything, we are better off avoiding it. So once you want to become pregnant, it's always good to be extremely careful. So for example, there's this particular drink we call Zobo drink. As of today, we don't know if that Zobo drink is helpful or harmful to fertility and pregnancy. So what did we do? We classified it as alcohol. So as of today, it's not just alcohol I want you to be mindful of consuming before pregnancy and when you're pregnant. Please also put caffeine in that category. The average amount of caffeine in a cup of coffee is about 85 milligrams, but it can be as high as 175 milligrams. And some people can consume coffee as if it's water. Now, if I were you, I would sit back and think about what I would prefer. Will I prefer to have something that will delay my ability to become pregnant, or will I deprive myself of certain things that at the end of the day, I will maximize my opportunity? If I were you, definitely I will deny myself whatever I might be addicted to. So you need to understand the bigger picture. Higher doses of caffeine also, for some reasons, based on current research, can also affect the quality of the sperm. Remember, when we're talking about the sperm, we're looking at 3 parameters: the sperm count, the sperm motility, and the sperm morphology. Of the 3 parameters, the more important one is the motility, because a man might have low sperm count and few sperm with good, morphology. But if they are fast swimmers, they can easily pass through the vagina, pass through the cervix, get to the womb, and begin the journey to the tubes. So whatever you take into your body can either help you or harm you. Now, also to the women that consume a lot of caffeinated drinks will also have reduction in their fertility. And if they eventually become pregnant, possibility they will have miscarriage, which I've already explained, it's high. Now, what can you do practically? Personally, you can go cold turkey. So cold turkey means you just stop consuming any of these drinks. You can do that. I know some people will be like, I depend on this, I depend on that. I understand. There is nothing we put our mind on that we can achieve. If you remember your why, then you can stop taking your coffee or all those caffeinated drinks today, especially that energy drink. Some people actually consume coffee, consume energy drink, then consume soft drinks on top of all those stuff. So you're actually having a multiplicative effect. So if it's only coffee you're taking, you're not taking energy drink. Some people will take coffee, then in between work, they will take energy drink. Then when they come back, they will take soft drinks, or when they are eating, they will take soft drinks. Meanwhile, they will be condemning people that drink alcohol. A combination of all these drinks can actually have a negative impact on your fertility. So what I want you to do is to be on the safe side. So I will personally recommend that all the women that want to become pregnant should reduce their intake of caffeine to 200 milligrams per day, approximately about 2 cups of coffee. But if you ask me personally, if you can go to cold turkey, go cold turkey. So going cold turkey means stopping completely. If you remember the reason why you're depriving yourself of certain things, you will be motivated. So that's my presentation very quickly, and I'm going to open the clinic now. So you have opportunity to ask your questions. How can you reach me? If you're in Nigeria, which is the jurisdiction where I can offer you consultation services, one-on-one, you can get a consulting package, then I can attend to you. If you're not in Nigeria, you can register for the masterclass. Masterclass is open to everybody. Once you register for the masterclass, then you will be able to communicate with me. But if you want to communicate with me one-on-one, you have to be resident in Nigeria and have a consultation package. So it's time for questions. Please feel free and ask your questions. Immediately after this clinic, I'm going to run a repeat clinic in Facebook. So if you're not in YouTube, don't worry. It's going to also have a repeat in Facebook. So join me in Facebook immediately after this clinic. But right now, the clinic is open for your questions. Start asking your questions, please. Do you have any questions? Bridget Reckford, if you have any question, please feel free and ask. And I think there's one other person behind the scenes. If you have any questions, quickly ask your questions so I can attend to you before I go. Remember the mantra of our group? We pray a lot. We are the praying group. Then we make love a lot. So if you're believing God to become a mother and you're having difficulties, make love every other day. That means you make love one day, you get a break, then you continue the other day. It works. The more regular your love making, the more you're improving your chance of becoming pregnant naturally. Then eventually you need to practice. So our concept is PPP. We pray, we play. Play means love making, then we practice. Practice means everything I've been teaching you guys, putting into practice, making sure you're doing the right things. Okay, so in the absence of any question, I'm going to take my leave. I want to thank you for attending my clinic this evening, and I will see you guys again on Sunday. If today is the first day attending, please make sure you click on that notification and also subscribe to this channel so that anytime I come forth, you will join me live. But if you were not able to attend the live event, if you have any questions, go to all the thousands of videos we have out there. Feel free, ask your questions, and we'll get back to you appropriately. Thank you so much and enjoy the rest of your evening. Bye-bye for now. You are 54. You need a baby for your husband. Okay, so let me use this to round up. Now, Bridget, you need to understand the importance and the relevance of your age. The biggest factor that will aid a woman to become pregnant is actually the age. Now, at 54, we need to face our reality. Possibility that at 54, you've probably gone into menopause is very high. So when you go into menopause, you no longer have X. When you don't have X, then possibility of you becoming pregnant is almost ground zero, because without the X, there won't be anything for the sperm to fertilize. So for you to become pregnant, we need your eggs, which is resident in the ovaries. So when you release the egg through the process of ovulation, the sperm will come in. The sperm will come in through the vagina, pass through the cervix, get to the womb, pass through the tubes, then get to the ampulla. The ampulla is a special place in the tube where it will meet the eggs. Now, possibility that at 54, you no longer have eggs, you are no longer bleeding for the past 12 months is high. And when you get to this stage, you've entered menopause. When you enter menopause, you no longer have eggs. You no longer have the possibility of achieving pregnancy with your own eggs, but you can still achieve pregnancy with donor eggs. So one of your options you can utilize is to opt for donor eggs, or you can go for surrogacy, or you can go for adoption. So donor egg, donor sperm, surrogacy, adoption will be your best option of becoming a mother. Okay? All right. Do we have any other question? Okay, thank you for coming. I appreciate you guys, and I'll see you guys again on Saturday. Until I see you, God bless you and bye-bye. Okay, you're in Jamaica. Okay, that's good. Thanks for coming around. So you can actually tag along and register for the masterclass. Masterclass will be on the 31st of July, 9 p.m. Nigerian time, and I will help you to understand things better. But thank you so much for coming this evening. I truly appreciate you. Bye-bye for now.